Dr. Kyle Hoth is the new president of the AMA here in WA. G'day, Kyle. Good to talk to you.
G'day, Simon. How are you?
Good, thank you. First week in the job?
Yep, first week down. Survived.
Survived, full stop.
Yep.
Are you a psych, Kyle?
Yeah, I'm a psychiatrist in my day job.
Yeah, all right. Well, I look forward to chatting to you at different times. I appreciate you coming on today, as Michael and your predecessors have done. Ozempic poisoning appears to be on the increase, or at least people ringing the poisoning line with issues with Ozempic. Now, this has really spiked, but I'd also note that it was always going to spike because it hasn't been around for that long. So the figures are alarming, aren't they? The people ringing the poison line about Ozempic.
Yeah, there's, huge jump up in terms of number of people putting in calls or concerns around Ozempic and Ozempic poisoning. As you said, we kind of expected it would happen, I guess, with a huge jump up in uptake. If you look sort of year on year, it's up 100-odd%. So that is going to correlate to more people having issues.
We mentioned Ozempic on the show probably a month ago, and our listeners are pretty candid. They spoke about their usage of it for different reasons. Is it something you prescribe in your day job?
I don't know, but we certainly have seen, through the AMA that uptake in use of Ozempic for weight loss in particular, and that the people feeling comfortable prescribing that becoming a little bit like your message on cannabis earlier. I think as people find it less of a barrier to prescribe, we may get into that territory of seeing people prescribe it when it isn't appropriate, and that can lead to issues as well.
I know a few people, a few colleagues, a few mates, a few friends who have been prescribed medicinal cannabis. That seems to be of concern too, Kyle. There's a national story in the Australian today. Medicinal cannabis doctors on notice over quick prescribing and prescribing in volume. Your thoughts?
Yeah, look, we know that medicinal cannabis has a role. It's a treatment with some particularly good indication in things like pain. I think anxiety, insomnia are two other things we see it used for quite a lot. But we know it has a role to play. But the concern with anything is when you attend an appointment, particularly if that's a short appointment online, with the assumption or the guarantee almost that you'll get prescribed what you like. That's dangerous. That stops being about using cannabis where it's appropriate and really just become dealers. It needs to be accompanied with a thorough assessment and prescribed for those right indications. We think cannabis is important to have available, but it's got to be appropriate.
AHPRA, the acronym AHPRA, Australian Health Practitioner Regulation Authority, they reckon there's 8 practitioners in Australia issued more than 10,000 cannabis prescriptions in just 6 months, and one practitioner issued 17,000 in 6 months. That's a lot, Kyle.
That is a lot. That's the hard one to argue with. That is too much. I can't do the maths quick enough in my head, Simon, but that's a lot of people today.
Yep.
That's wholly unreasonable.
Yeah. I'm not aware of this. I asked this genuinely not knowing. Can you get medicinal cannabis through InstaScripts or Instant Scripts, those crews?
I don't know about those ones in particular, but there absolutely are online services where you can get cannabis with a relatively low barrier, I would say. And that's our concern, right? Not cannabis itself, but the fact that it is just too easy to get these kind of scripts. And like you're saying, if there are doctors out there prescribing that many scripts in a 6-month period, that can't be accompanied with a thorough assessment to make sure that what they're doing is safe. That just can't be the case.
Is the prescribing medicinal cannabis in Kyle Hoth's toolkit? Do you prescribe it in your day job?
I don't prescribe it, but I do have a few doctors that I know do a good job of prescribing it, and I often refer my patients to them and work collaboratively with them when it's appropriate. So I have a number of patients on medicinal cannabis, and they do quite well on it.
All right. Thanks for coming on today. Kyle, what do you see as the biggest challenge for you in the job as AMA president here in WA? What are your big ticket items? What do you hope to achieve?
I think kind of continuing on the work of Michael and those before me in terms of the access to care. I think access to care is going to continue to be a big problem for us. We can talk about it through the lens of ramping, whether we talk about it through the lens of beds, or one that I guess it's a little bit dear to my heart, and that is, access to mental health care. I'm sure we could look at a singular thing like ADHD, but you could look at the entire sort of mental health landscape, just getting getting to see a specialist, getting to see a doctor is just too hard now, Stain.
Yeah, all right. Thank you for chatting to us. Good luck, and I look forward to chatting to you at different times. Thank you, Kyle.
Anytime, Simon. Take care.
Cheers. Dr. Kyle Hoth, the new president of the AMA. Michael Page has been very accessible and very articulate on matters medical.